Dental care. Guess what is coming to your neighborhood dentist's office? A new survey says dental patients, by and large, don't want to see a white-coated robot with a drill anytime soon. It's robotic dentistry. Dr. Melissa Santilli on the line right now. Good morning, Doc. How far are we away? How far are we away from this?
I think that it's definitely possible that more technology is coming into the dentistry, especially in America. Because right now, for example, in my practice, we no longer use traditional impressions. We use 3D printing instead. So we scan the teeth, and it comes up on the computer as a 3D model, and we work with that instead of kind of the traditional way of doing it.
Wow.
But in terms of, a robot that can replace a dentist completely during the surgery, it might be kind of some time away because of, I think, a lot of the human rights in America.
Right,
You have to make sure that this robot will not make mistakes.
I have to tell you, one of the things, as you know, and I had never lost a tooth until one day a listener gave me some really nice Italian candies. They're those nuts that they have chocolate around, and they're hard those. Mm-hmm. And I was biting on them, and I cracked my tooth, hoping that I could get a what would you do? You'd do like you'd
filling,
drill in, and hopefully. Well, the crack was the crack was so bad they had to pull the tooth. So I had an implant, and one of the things, Doc, is one wrong move, and many different things can happen. You could lose feeling in your face. There's a lot of different things that can happen, right?
Yeah. So if that implant goes a little bit too deep, it can hit the inferior alveolar nerve, which is controlling the side of your tongue, whichever side it is on.
Yeah.
And that controls your taste and your feeling on that side. So you definitely don't want to be completely numb there forever. And also, you don't want anything to keep drilling because it can actually go through the bone and out the other side. So it's something you definitely want to stop.
I do have to say that when I had my eye surgery done, and laser eye surgery, that was all basically computerized. And while there was a doctor there to run everything, it was still computerized and robotic. I guess I'm okay with that, and I think we're seeing a lot more with that with medicine. But to say that it's going to replace you, Dr. Melissa Santilli, that's not going to happen, right?
I think that it's definitely better if a doctor can be still present to supervise or to somehow, like you said, run it and have it enhanced, because I know that they do surgery with robots. It could be a lot more precise in some ways, as long as there's a human there to supervise who is trained, professionally. So if something goes wrong, they can handle it. I wouldn't just set anybody to kind of supervise. I would still want a doctor present.
Yeah.
Yeah.
And the good news is that you're having the doctor there to stop the procedure or to override the system. I think that's all important. But I think we're going. Listen, heart surgeries are done using robotics today. It's really incredible. Very interesting, doctor. So in a limited fashion, this is on the way.
Yeah, and also simpler processes like polishing, cleanings, or whitenings. Those are definitely, I would say, on the table for a robot to help assist, because then you have more efficient use of time, so you don't have to wait around for the one hygienist or the doctor to come do something. Yeah,
all right, makes sense.
So that might take. Yeah.
All right, cool. Dr. Melissa Santilli, thanks for taking the time this morning. I appreciate it.